Hello and welcome to the Socialist Party's public broadcast this week. I'm Scott Jones, I'm part of the editorial team of the Socialist newspaper, and I'm going to be joined today by Rob Williams, who is the chair of the National Shop Stewards Network, and Hugo Pierre, who is a member of the Unison Public Sector Union's National Executive Committee and a convener for the union in schools in London. He'll be speaking in a personal capacity. On Sunday, the Prime Minister Boris Johnson gave a muddled message on the ending of lockdown. But one thing was clear: Johnson's government is putting bosses' profits before workers' safety. The continuing COVID pandemic is being used by the bosses and the Tories to put a gun to workers' heads: your job or your life. How many workers will be put in danger by instructions that could lead to cramped public transport and people going back to workplaces with no plan or system to make them safe? We'll be discussing questions like this today and asking what the trade unions can and should do to protect workers in the worst pandemic-hit country in Europe. And we want to ask you to help us build the audience by sharing this video, starting a watch party, or posting the names of friends or workmates in the comment box below to bring them to the video. We're not live today, but we hope you'll comment on what we say, and better still, get in touch with the Socialist Party. And we can point you to one of our 60 or 70 weekly Zoom meetings taking place all around England and Wales, or put you in touch with our sister parties in the Committee for Works internationally if you're watching from further afield.
Okay. Hi, Hugo. So,
hey, hi, Scott.
As someone who works as a union convener in schools, what do you think about the Tory government, the fact they've announced that certain school years will be going back from the 1st of June in England, which has, of course, been opposed by unions in schools, parents and teachers? Why aren't they safe to go back?
Well, there's only one reason why they want to go back, as far as I'm concerned, and they picked particular year groups. So nursery, which they didn't actually announce on Sunday, but it's come out in the documentation, reception, and year one. And the only reason why they've done that is so that parents can go back to work. There's no other reason for it whatsoever. I don't know where some of these people, if they ever went to a nursery class or to a reception class or a year one class in mainstream, there's absolutely no way in which you can social distance. It's even madder because they're saying, oh, they could be taught as small groups. And those children, if you ever go to a nursery class, sometimes you'll see some quite big nursery classes and they're all completely open. And the children have access to whatever they want to use during that time. The only time when they're actually brought together is when it's what's called carpet time or story time or what have you. So they picked the worst years in which to try and practice social distancing. And they've done it for one reason and one reason only, and that's finance. And there's uproar, absolute uproar amongst school support staff who actually are quite often, there's more of them proportionately in those years, particularly to support the learning of the children. And obviously people like nursery nurses are specialists in that. So, you know, we think it's absolute madness to even think that you could bring those children back by the 1st of July. And we're completely opposed to it. Completely opposed to it. We've got to do quite a bit of union organising to make sure it doesn't happen. To make sure that there are other year groups that potentially they could start thinking about bringing in if they did it carefully. But you see, the other side of this is, I think the government haven't said it in any of their documents, but I think a lot of the Tories believe that because these children don't get sick with coronavirus, then that's not a problem. But actually, the children not getting sick isn't the issue. It's the fact that they can carry the disease and they can spread it. And so without mass testing, you know, without screening of staff like they do in hospitals where all the staff are tested, or in care homes now where eventually they brought it in because of the absolute scandal of what's happening in care homes, without screening all of the staff and testing to see whether they've got the virus or not, you know, and there's some problems with testing children. I understand that, but without screening all the staff, you're just asking for the disease to go back in the community, and you know, particularly in, and you know, we're going to come on to this in a minute, but particularly in poor communities, what's going to happen? You're going to see the R go back up again, go back above 1 again in those local areas. It might not be in the posh areas where, you know, these people who've never been to a nursery school you know, and don't know what it's like teaching. It might not be like that in those areas, but definitely in working class areas, it's going to shoot the R back up again. You know, so it can't be on. We've got a job to organise around this, but I think that we're pushing an open door. I've spoken to loads of Unison members in my area, had met some Unison members in different parts of the country, and everybody's saying the same thing. The government have got to back down. If they don't back down, then Section 44 of the Employment Rights Act is where we're going to be heading, you know, with people not being able to come down because their health and safety can't be guaranteed. You know, we don't have time to ballot people. We don't have time to, you know, to go through all the various consultation mechanisms we might do to have an official industrial action ballot. But the only thing we've got left is to try and organise around this Section 44 of the Employment Rights Act and make sure that members of staff, their safety is the most important thing. If we can't guarantee staff safety, then we'll end up in a situation like it's happened in the, you know, like I say, in care homes, in the NHS as well. And we don't want that. You know, so far, I think there's been something like 70 school staff have died as a result of coronavirus. We don't want it to be more because of the recklessness with which this government is prepared to reopen schools. It's not on.
So like I said, Rob Williams is joining me. Hello, Rob.
Hello.
And thanks for speaking to us today. Something which has been talked about a lot during this pandemic, and especially since Sunday, is Section 44 of the Employment Rights Act 1996, as if it's a magic wand that can be waved in workplaces to shut them down and allow workers to walk out of unsafe conditions. What is Section 44 and how can workers leave unsafe workplaces?
Well, first of all, here is Section 44 of the Employment Rights Act 1996. I think the first thing to be said about it is probably until the COVID pandemic, a lot of workers, perhaps even a lot of reps, hadn't heard of this bit of legislation. And the truth is, I think it is an important tool to be in the armoury that the unions can use and union reps on the ground. But I think that's the issue. It's one weapon, one tool that can be used. I think what we can't shy away from, however, is the best protection workers can have. First of all, is to join a union, is to be in a union. We take nothing for granted that, you know, workers see that. And of course, in many places, the union isn't present. So the first task really is join a union, get organised in the union and contact one of the unions in your sector of the economy. But of course, the most important task of a union, of a workplace, is to act collectively, is to act together. That's where we get the biggest strength, and that is obviously tantamount right now to what is absolutely necessary. And therefore, when I say that Section 44 is a useful tool in that, is that if you think about it, what's really posed right now is the workplace safe to work in, or is it safe to return to work in? And therefore, who decides that? Our opinion is that it's the trade union that decides that. We can't trust management. Why can we trust management? They want us to come back because they want to restore their profits. We can't trust the Tory government. This is a government, as you said there, Scott, it's a muddled message. It's not, it wants workers to return to work, yet hundreds of people are dying every day of the week. The PPE they've ordered into this country doesn't meet NHS safety standards. They're missing their testing targets, et cetera, et cetera. So we can't trust this Tory government because obviously it is acting in the interests of those companies and big business that is interested in their profits. So therefore, for us, the organisation, the unions have to put, their trust in, if you like, is the trade unions. And even then, they have to fight to ensure it's the best unions possible. But if you're in a workplace, for instance, and, you go to the toilets and the companies say, oh, sorry, all the washroom facilities have run out. We've got no hand sanitizers anymore. And you say, okay, when are they coming? Well, they come in a week Monday. Well, really, as far as we are concerned, at that moment, that workplace stops being safe. Or for instance, they say, we can't comply with 2 metre social distancing. That workplace stops being safe, or rather isn't safe to return to. And therefore, our view is that the reps and the health and safety reps of the trade union talk to the members, obviously liaise with the union itself on a regional or national basis, and then the members meet together, complying with social distancing, discuss the way forward, come to the conclusion that this is no longer a safe place, and then use Section 44, if you like. One, so that members who perhaps aren't confident see that actually they're on the right side of the argument, but then go to management and say, unless you make this place safe by complying with this, then we are not going to return to work, or we are going to leave the workplace. And of course, our position is any workers who can't go to work because the workplace isn't safe are paid 100% of their wages. So when I say it's a useful tool, I think it's useful in that sense.
Okay, thanks, Hugo. Another feature of the pandemic is that amongst all the tragic hundreds of workers who have died, a disproportionate number of them have been Black and Asian deaths. So why do you think that is, and what could be done to protect them?
Well, there are a number of reasons, but I think if you distill all of them down, I mean, let's start off with this. They're now doing some research into what the genetic factors are around this disease. Now, race and genetics is not a straightforward issue, actually. It's, you can't say because somebody's Black or because they're Asian, they've got different genes from somebody who's, say, Caucasian or what have you. I mean, I'm from the Caribbean, or my ancestry is from the Caribbean. I know there's a big part of our ancestry that's actual French, from central France somewhere, I think, one of my family. So you can't separate out the genetics like that, but we do know there are some genetic traits that are more prevalent in Black and Asian communities, like sickle cell, like diabetes, those sort of things. So some of those things might have had a little bit of an impact, but I don't think that that's the real reason behind why there are more Black and Asian people dying of coronavirus. I think probably the number one factor is poverty. It's the fact that a lot of Black and Asian people live, for example, in London. There's a very high proportion of Black, Asian, and other minority ethnic people living in London. And so the virus has hit London particularly hard. And it's hit the working class communities in London particularly hard. I mean, there were some figures released the other day that I think Newham, twice as likely to die as some of the richer areas of London. And that makes it absolutely crystal clear to me, because on top of that, you've not just got a high proportion of Black and Asian people living in working class areas, you then also got all of the problems that working class people have, particularly in inner London. You get, and actually areas of London like Newham and that, you get a lot of people who are living in overcrowded houses. That's a feature of it. You've got a high density of population as well, with a lot of people living in flats, have got no access to, to things like gardens and stuff like that. You've got communal stairwells, lifts, all of those sorts of things that are going to mean that the people are going to be more likely to get the disease. You've also got proportions of health inequality in the inner cities, and particularly in London, are rampant. There's surveys that will back this up. I haven't looked at them recently, but if you look at the proportion of doctors, the proportion of hospital beds there are for people that live in inner London, particularly in places like Newham, Tower Hamlets, Hackney, areas like this, compare them with the proportion of hospital beds in some of the better off areas of London, or some of the better off areas of the country even, you'll see that London has a lower proportion of health, but also things, you've got all sorts of diseases that have come back into London that, you know, probably have died out in other parts of, in posher parts of the country. And so, you know, you've got that basic health inequality that there is as well in poorer communities, and particularly in London. I think the third factor particularly relates to the NHS actually, but you've got so many Black and Asian workers working as frontline workers, you know, working in the NHS, working as carers, working as cleaners, working as porters in hospitals, working in those sorts of frontline jobs. And therefore, they're the ones that are coming into the contact with the disease first before anywhere else. There's also been some well-documented studies that in the NHS, which have shown that the grievances that Black and Asian workers have are less likely to be taken seriously by health service management than the grievances of other staff. So you've got sort of almost like an endemic racism within the NHS, which has also contributed to, you know, a thing where if a Black worker was to say, well, actually, I don't think I should be doing that, they're not listened to. You know, we've seen all of the shortages that have happened around PPE. Now, I'm not saying there's a deliberate attempt to deprive Black workers of PPE, but probably you can imagine that many have been disheartened over the years with not getting what they were. Perhaps there's been a subconscious, well, I'm at the end of the queue for this, you know? And so I think it's been well documented in the NHS, and the unions are trying to take up some of the issues around some of the racism that workers face in the NHS. And so I think that's probably one of the reasons why you've seen so many, such a high proportion of NHS staff who are Black, Asian, or from other minority backgrounds dying of this disease. And it is an absolute scandal. But to me, it's the fact that Black and Asian workers are concentrated in the working class that has meant they've suffered disproportionately from this virus, concentrated more so than any, you know, than other groups. Meant they're more concentrated, and they've suffered more as a result of this this pandemic. You know, this pandemic has shone an absolute spotlight on all aspects of healthcare, and you know, whereas Britain should have been in a fantastic place with a national health service, with a free service, it's shone an absolute spotlight on all the weaknesses of the NHS and all of the scandalous cuts, privatisation, breakups, marketisation, all of that that's taken place over the years. And actually, you know, I know the unions have done some campaigning in the past, but it's not been enough. You know, the unions now need to really step up their game, and we need to be really organising a mass protest to make sure that the NHS gets all the funds it needs, that all the privateers are wiped out of the NHS, the drug companies that fleece the NHS left, right and centre are forced, well, are either nationalised, you know, which I think would be the best thing to happen, so that the profits from those industries that they're making, well, A, they're not making profits, but B, whatever excesses are made are ploughed back into research. You know, could have had a vaccine around this COVID-19 a lot sooner if some of those profits had been ploughed back into research instead of being just divvied out and given to shareholders and dividend holders. So, yeah, you know, Black and Asian workers, I think, have suffered badly as a result of this, but I think it's fundamentally, it's not because of their genetics or it's not because of anything like that. It's fundamentally because they're overrepresented in the working class in this country. And, you know, particularly in low paid jobs with low levels of unionisation, etc. Those are the things that we've really got to tackle to make sure that we put this right.
Great. And we've obviously talked there about the key role of trade unions in helping make workplaces safe, make workers safe. What have you made of what the trade unions and their leaders have been doing so far, and what should they be doing in your opinion?
Well, I mean, I think we have to say that I think the unions are doing a lot to try and make the workplace safe. And of course, we should say that the unions themselves are the biggest organisation in society, 6 million members. You know, the unions all have safety reps, shop stewards, reps, etc. But I think what's been clear in this pandemic, there are two processes. The dual character of the trade unions has come to the fore. On one hand, there has been a tendency, certainly at leadership level in some unions, to want to come to a consensus with the government. In reality, a national unity agreement with the government, almost to suspend the struggle, if you like, to suspend the class struggle. Well, of course, the point we make is in this pandemic, the class struggle exists and actually it's been sharpened. When you get, I think the estimate now is about 300 plus NHS care workers have died, 30 plus bus drivers have died just in London. But by the end of April, over 200 construction workers have died. And the statistics are devastating. This is a class war reflected in the pandemic. If you're black, Asian, ethnic minority, then you tend to be far greater at threat of your life. Why? Because many of them are in the lowest paid jobs, in the worst housing, etc. If you're in manual labour, you're at least twice as more likely to be suffering from this. And it's interesting, there's been articles in the paper in the last day or so that when you look at the London transport, you see the class character of society, because the working class is going to work. If you're in a more managerial job, you're more likely to be able to work from home. So therefore, it's this class character. And I think as the pandemic has gone on, you've seen the huge pressure come from below within those unions, and there's no doubt that pressure is starting to be felt. In some respect, Johnson's muddle-headedness, his mixed messages, if you like, is a reflection on the different pressures he's facing. I think it's a reflection of the pressure that there's a split in the Tory cabinet between the hawks, if you like, who don't care about the health risk, want everyone in work as soon as possible because they're wary about the economic downturn. You've got others who are probably a bit more far-sighted, are wary actually of a reaction against the Tory government and the capitalist system itself. But also, I think there's a pressure coming from the unions. But we should make this point. A week last Sunday, this Tory government opened up a consultation period on its proposals, which obviously have been tabled in the last few days. People will be astonished and I'm sure angry that consultation lasted, well, it was supposed to last for 12 hours. You think that through. A normal consultation for job losses is 45 days. Used to be 90 days until David Cameron cut it in half. So we go for 45 days consultation over, say redundancies, etc. But for changes to the lockdown, when 40,000 at least have died, the Financial Times thinks over 60,000 people have died, was going to last for 12 hours. It's a scandal. And in our opinion, the trade unions at that stage should have brought that to the attention of workers, should have called an immediate press conference, have said this is a scandal, this is a sham consultation, we can't trust this government, and used that as a platform to build a collective, united front against this Tory return to work that puts profits before workers' lives and workers' safety. But in reality, we had to wait for that to seep out, if you like, over the few days. But I think perhaps the sectors where that's been most felt is the transport workers, those workers who are in the front line on our train stations, in our buses, on 2 platforms in London where clearly social distancing is not possible. And those unions now are making it clear that they will support those workers who are not prepared to work in an unsafe situation where social distancing is not possible. But I think perhaps the section of workers where it's been posed sharply, really, is the school and teaching staff, that in England now, they've been told that schools are going to reopen or start reopening on June the 1st, and that has led to an explosive situation. We have heard of reports of hundreds of teachers and increasingly parents involved in Zoom meetings up and down the country. And the Socialist Party and the National Shop Stewards Network, we give out total support, obviously, to all workers in the front line, including the transport workers and including the teaching and school staff right now. And really what we need is, don't we, is a united front across the trade union movement, across the working class, to confront this government and to say we don't stay in work where it's unsafe, but we do not have a return to work when we have got no confidence in this government and its proposals at this stage. And we believe there should be an emergency meeting of the TUC General Council, and that should be a council of war. That should be saying to the Tory government, we've got no confidence. You're putting our members and the wider working class at risk of their lives because you haven't got a safe system in place. You've been totally unprepared for this pandemic, and you're putting people at risk by forcing them back to work.
Thanks a lot, Rob and Hugo. Across the country, Socialist Party members are playing leading roles in fighting for workers' rights in and outside workplaces. In the Socialist paper, every week, you can read reports from the front line and from inside the trade unions about what Socialist Party members and workers are doing. We're effective because our members look to the collective strength of working class people. And if you agreed with what you heard today, consider joining us. Being in a party that's confident of workers' potential gives you the strength to stand up to the bosses and ensure safety, better pay, terms and conditions. There will also be a National Shop Stewards Network meeting on Saturday the 16th of May at 3 p.m, so you can hear from workers themselves and more about what we've said today. See our Facebook page, the Socialist Party's Facebook page, or the NSSN Facebook page. See you there and see you next week. Thanks.